Hello, everyone, and welcome to South Dakota Project Firstline office hours for January 2024. Welcome to the new year, and thank you for joining us for our presentation and education. Next slide, Rebecca. My name is Jess Stanko. My background is healthcare administration. I'm also a registered respiratory therapist and certified for infection prevention in the long-term care setting. Rebecca, I will let you go right ahead.
I am Rebecca Syme. I'm an RN. I have a varied background in the OR, dialysis, long-term care, as well as others.
All right, next slide, please. Also with us today from the South Dakota Foundation for Medical Care, we have our coworker with us, Sherry Fast. She is the HAI coordinator. She will be our guest speaker and sharing some great information with us today. Next slide. For those of you who don't know, South Dakota Project Firstline is a collaborative initiative with the South Dakota Department of Health. The education and tools that we share with you today were created by the CDC. All of the information is CDC approved and utilizes the tools that are available to you through our website to utilize as you need. I will go ahead and let you go to the next slide, Rebecca. Just quick before Rebecca kicks it off and takes over the presentation, I just want to share with you our office hours is an opportunity for you to ask questions, whether you want to come off a mute or put a question in chat, and we will answer those throughout the presentation or at the end as we wrap up. And I will turn it over to Rebecca.
All right, so we're going to go over another one of the microlearns today. If you've been with us in the past month or two, you have seen us showcase these microlearns. What they are is Project Firstline offers infection control microlearns that are short, adaptable, easy to use. Today we're going to cover cough and congestion. How the microlearns work and kind of how they're designed is they're already put together, so you can kind of plug and play, utilize things that are happening maybe specific to your facility. Each microlearn focuses on a single infection control topic. Healthcare workers can easily apply the key points to their daily work and perform recommended actions to keep germs from spreading. So the use of the microlearns can be incorporated into existing opportunities where groups of healthcare workers gather, maybe your morning huddles or team meetings, things like that. Sessions can be led or facilitated by an experienced team member with infection control expertise. So really you can just designate someone, kind of plug and play. So how the microlearns work is they kind of go through the discussion guide, which is an introduction of the topic, an opportunity to expand on that topic, and then some open discussion with your team, followed by a wrap up and reinforce. So that's kind of the general structure of how they work. And we're going to quickly kind of make our way through the cough and congestion. So this the microlearns come with ideas, suggestions, kind of preloaded based on the topics, such as cough and congestion here today. But it's not a script, so you don't have to follow it word for word, but it gives you a good start. So let's learn about cough and congestion and put the microlearn to use. Coughing by itself can be caused by a lot of things, but a cough in combination with congestion, a stuffy or runny nose, runny eyes, and a nasally voice is commonly caused by a virus. These viruses spread easily when an infected person talks, breathes, coughs, or otherwise blows air out of their nose or mouth. One person releasing these germs into the air can infect multiple people quickly. Some of these viruses don't cause major problems to healthy people, but can cause harm to vulnerable patients. If you're near a patient with a cough or congestion and don't know what's causing their symptoms, you can protect yourself from breathing in infectious particles by using a face mask or considering the use of a NIOSH-approved respiratory mask according to your facility's policies. As soon as possible, the patient should be placed in a separate room away from others. The patient should wear a mask to keep their germs from reaching you or others. If it's safe for them to do so, if they are over the age of 2 and able to remove a mask on their own if need to, check that air vents in the room are not blocked, as this could prevent ventilation system from functioning properly. So things to be mindful of there. You can open discuss maybe this is a great opportunity if you want to discuss your mask policy or where other things are located, or at any point in time you can take questions from your staff. So you want to discuss with your team, what do you do when you see someone who has a cough or congestion? Kind of reinforce what your policies are and the areas that we covered earlier. Um, Also, you may have some staff that worry if they might catch something. So, an opportunity to discuss that and reinforce protection of them while they're doing their duties and providing care. And then, do you have all the tools that you need and any information you need to do your job safely? Again, an opportunity to discuss where things are located in your facility and any questions that may have, as well as a team. Are there things that need to be discussed? Do you need to reach out to other team members, ask questions, inform your staff, those types of things? So this slide kind of shows up the wrap up and reinforce. So be on the lookout. Know that viruses spread quickly, how to decrease the risk, know what to do, know your resources, and work as a team. So just kind of another reinforcing open conversation. With that, we kind of went through that quickly, but we know Sherry usually adds some really good stuff. So we're going to let her take it from here.
Well, thank you for having me again, you guys. Again, I'm Sherry Fast. I am a nurse and am, I would say, leading the HAI work in our South Dakota Foundation for Medical Care in conjunction with the Department of Health. So what we do is go into facilities and do infection control risk assessments. These are proactive assessments, and I'll talk a little bit more about those at the end. But we found that showing some of these concern areas is really beneficial to facilities so that they realize these are events occurring in their facility, in your facility. These are common things we are seeing throughout all facilities in South Dakota, and we just want you to be aware of them. So I thought we would share some of these findings on the related to respiratory care, cough and colds. So as you can see in this first picture, we have respiratory etiquette probably not being followed um, very well. We see wadded up used tissues in our handrails on a kitchen counter. And so we know that respiratory etiquette, we're at the time of year that's really on everybody's mind right now. And so we need to be diligent in what we're doing as well. So cover your cough and your sneeze. Turn your head if you're going to cough and sneeze, and cough into the upper part of your arm or your elbow. Throw away your tissues. Don't leave them laying around. Have garbage cans available for people to put their used tissues in too. Um, these pictures really demonstrate how important respiratory etiquette is. So while you are out and about, um, make sure you're looking for these things. The other important piece of this is making sure that you have mask and hand sanitizer available at your entrances for visitors and contractors, vendors to use. When we are out looking at facilities and helping them, we see sanitizer that is empty, masks aren't available. So just make sure that those things are done. In the iCars that are developed by the CDC, they have explicit guidelines what we look for. And some of those I can just read you the verbiage on them. Be consistent with entrance screening for healthcare personnel, patients, visitors, including vendors or contractors. Consider using signage at your entrances, uncovering your cough, wearing a mask, hand hygiene, disposal of tissues. So those are things that we look at. So make sure that you have those available. Next slide. Healthcare equipment is also a reservoir that can harbor unwanted germs and bacteria. So when we are in facilities, we often see these suction canisters and other equipment with tubing that is unwrapped and ready to use for patients. And although I understand why this practice is occurring, we don't want these tubings exposed to potential contamination while treating other patients and residents. So consider this suction canister in this first picture in an emergency room in a hospital. And even if you're not using that on your current patient that's laying in that cot or that bed, um,
That could have been contaminated by the previous patient, and now you have to go use it on the patient following the one you're taking care of. It's a big risk for infection control and a healthcare associated infection. So just be mindful of that. There's a lot of studies out there on where germs live and how long they live. And to me, this is just an infection waiting to happen. How can we protect this? We could cover it with a garbage bag. It takes 2 seconds to whip that garbage bag off of that equipment. And yet it shows to the patients also that that equipment is clean and ready to use. There's another part of the ICAR, staff have to know what's clean and dirty equipment. They have to be able to identify that. And so in your facility, do they know that? This second picture is a picture of I think they used it as a crash cart in a, and it was in a long-term care facility, which granted, they don't have they don't use crash carts near as much and emergency equipment. But you can see here, this was probably not cleaned very well. So could we protect that a little bit better should we have to use it in a hurry? So just be mindful of those things. Next slide. Again, just some other pictures of what we found. That third picture there with the bag over the equipment, just it looks so clean, and you would want that to be used on you. I think I would want that preferred to that second picture where all that tubing is wrapped up and exposed, and I don't know if it's been coughed on or who's touched it. Next slide. Talking about cough and colds and respiratory season, we can't not talk about a CPAP. We can't not talk about nebulizers and equipment and how we store them, how we use them. You can see that there's a lot going on in this picture of how we're storing our equipment. Our nebulizers, we want to make sure that we put those in a clear plastic bag with some vented holes in that. We want to clean with tap water, or I mean, not tap water, with sterile water or distilled water. So many facilities are still rinsing their nebulizers with tap water. So make sure you're looking at your policy. The new recommendations from APIC and AARC will tell you distilled or sterile water. So no more tap water. But you can see there's just a lot happening, a lot of potential for contamination with that mask. Next slide. Another just place where we look. So you can see on this first picture, they're storing this on the bedside. So if we're not using that equipment, let's just put it away. Floor is a very dirty place for our tubings to be hanging out on. So Jess, do you have anything you want to add with the respiratory equipment?
I do, especially with the CPAPs and BiPAPs, and we know that there's the new water management information out and available for utilization, and that's a big focus that we're finding. So your CPAP and BiPAP, because you are supposed to put water in that distilled water for your residents or patients to have humidity, if that is not on your cleaning and disinfection plan, if it's not in your policy for how you guys are supposed to clean and disinfect, those type of things, that's an area that really could be written up and looked at for your water management piece, just like it could be for leaky pipes or anything like that. So just keep that in mind, that these are one of the areas with the water management plans that might become part of that, and really make sure not only that it's in your policy, but your staff know that and are able to speak to that in case the surveyor were to ask questions.
Okay, next slide. So again, this just shows some respiratory equipment. Again, our nasal cannula just on the overbed stand. You know, could we just put that in a bag just to protect it if the patient or resident is not using it? And then let's remember to clean our concentrators. You can see on this picture, this one's quite dusty and dirty. Those concentrators need to be cleaned on a regular basis. Next slide. So again, you can see, so this nebulizer equipment, they're just rinsing it. This particular facility did rinse with tap water, and they just put it on this little washcloth to dry. That washcloth was dirty. It had been there a while. I would rather see you use a paper towel and then dispose of that after you've rinsed out your excess water and then put it away properly, than use that washcloth over and over again. because we don't know what's all been said on there. And then again, just your water, that's a pretty big jug if you're going to use that in a room for a patient. You can see the condensation in there. Probably don't need a gallon jug for a nebulizer. So just something to think about. If you're going to do that, date your jugs too.
I'm just going to jump in there. If you're using that same bottle of distilled water for a CPAP or BiPAP, the recommendation is 2 to 4 days from opening for your CPAP and BiPAPs. That was a question that came into chat.
Next slide. Again, this shows some more concentrators, and I just wanted you to be aware in a lot of the storage units that are closets that we find these concentrators being stored. I circled here where this tubing is. I don't know if that's clean or dirty. As a staff person, I need to know if that's clean or dirty. The concentrator behind has a crack on it. Probably not the best use of our concentrators. And then the concentrators also have filters either on the back or the side, like this one with a kind of a porous, spongy like filter. So those need to be cleaned. Don't neglect those and don't forget those as well. All right, next slide.
I'll just pop in here quick. What we often see on the cracks that Sherry's pointed out there is people use tape as a fix-it. We don't want to use tape that poses an infection risk. So if those are cracked and broken, we can't put tape over them as a fix. We need to report them to somebody to see if there's something that can be replaced. Otherwise, put them into retirement.
Just when we think about oxygen tanks and storage, they need to be secured. They need to be separate. You need to separate your full from your empty tanks, and then they need to be, like I said, secured. So just be aware of that. Check where you're storing them. Next slide. All right, so now we talk about oral care when we talk about respiratory infections, cough and congestion and colds. We know that providing good oral care can reduce those infections, reduce pneumonia. There's a lot of studies out there on infections that came from either ventilated patients or using a trach or just not having good oral care when you have a respiratory infection. So the CDC and the American Dental Association recommends changing your toothbrush every 3 months and to store them upright as that picture depicts, if at all possible. When your toothbrush starts to show its wear and tear, like this one in the middle, let's replace that. Let's not store them on the top of our paper towel dispensers with the toothpaste and the other resident in that room side by side. For one, I don't know whose that is. How would I know which resident's toothbrush that was? And then there's a pen there. Just, we can do better than that. And then I would just, I guess, challenge you to look, do you have a oral hygiene program? And what does it look like? How are those toothbrushes getting changed out? So just something to think about. Next slide. We have to talk about water when we talk about infections and respiratory. And Legionnaire's disease is a lung infection that's caused by the bacteria called Legionella. And Legionella, people get Legionella when they breathe in small droplets of water or they swallow contaminated water that has Legionella in it. So those symptoms are cough, shortness of breath, fever, chills, real flu-like symptoms. Legionella is not contagious, but if you have that in your system, in your water pipes, in your drains, other people that are immunocompromised or prone to get lung infections can very much be affected by this. CDC says 1 in 10 patients can die if they have Legionella, so it's not something we want to mess with. The CDC has come out with a new infection control risk assessment for water. It's called a WICRA. I encourage you to pull that out, look at it, see what you're doing in your facilities for your water management. So we need to flush our drains. We need to flush our water faucets that aren't being used. Legionella is often found in like shower heads, in sink faucets, in water fountains, in plumbing systems, in hot water tanks, hot tubs. So those places that are not being used frequently, they need to have water run through them to prevent Legionella growth. So look at this first water fountain here. It doesn't look like it's been used. Where the water comes out is rusty. Would you really want to put your mouth on that as a person? I don't really want to. I don't know about you guys, but that needs to be replaced and fixed. This middle picture was under a sink in a kitchen area, dining room area. A lot of water damage, mold can get under there as well. And then we see one thing we look at in facilities, and we find this, I don't know that we haven't found one in one facility, actually. We see a lot of water corrosion, we see buildup, and that tells me that we have a leak somewhere, something happened. So those need to be cleaned up, replaced, whatever you need to do to get your faucets looking a little better than that. The other thing I would say in regards to Legionella, make sure that your city water or whoever checks your water, you get a copy of their testing for what their waterborne pathogens are, especially Legionella. You're going to want to have at least a copy of that yearly. And then if you have a water management plan, somebody needs to know you have a plan. They need to know the pipe system, where the water comes out, and then to audit those sinks and drains that aren't being used. That includes eye wash stations. We see a lot of facilities, some of the older ones particularly, they might have a shower room or a patient room that they're not using anymore, and it's used for a storeroom. And we open that storeroom and we get this distinct odor where it smells very musty. So that tells me those legs are not capped off. So just be aware of that, flush them, doesn't take too long. Next slide. Ice machines, water machines, we need to make sure those are on a regular cleaning schedule. Most places we visit say they are on a quarterly cleaning schedule. That's great if that's all you need. This one, they were able to show that they had cleaned it 3 months ago, but I stuck my finger up there and I got that out on my finger. So if it's 3 months, obviously it needs to be maybe monthly. So just be aware of that. We don't want people getting sick from something like that. Next slide. Mold and mildew from plants. We see this a lot. Plants, definitely make our places look homier. Aspergillus is a fungal infection that can live indoors and outdoors. It's a mold that grows, and it's found actually in decaying leaves on plants, and it's also in crops. So make sure that your plants look healthy and they're well cared for. That paper plate probably could be replaced underneath that plant. So just be mindful of that. What does it look like to your visitors too? Next slide. Air exchanges, vents, and fans. We look at these things and I think they speak for themselves. These are registers and vents that are dispersing all kinds of stuff out into the air that we're breathing and our residents and patients are breathing as well. So make sure these are on a cleaning schedule. Make sure somebody's looking at these. Yeah, I don't think we need to talk about that anymore. Next slide. This first one, actually, I was using the restroom in a facility and I looked up and that's what I saw. Didn't make me feel real great. So of course, then I start looking at other things in the facility. So take that down, clean it out. And then we also look at stained ceiling tiles. Do you have a water problem? If you have stained ceiling tiles, can also grow mold and mildew and things like that. So once I see a stained ceiling tile, I'm going to keep looking. So something that surveyors might want to do, but you want to have that pleasingly to your visitors as well and your residents and patients. Laundry, this particular place, this is where they folded their laundry, and that air conditioner, I get it's hot in there, but it was blowing a lot of dirt and dust right onto the clean linen. So we want to make sure that that is protected. So let's either move where we're folding our clean linen, or let's clean that air conditioner out so it's not blowing around. Next slide. Can't not talk about microfiber and feather dusters. Those are no longer recommended. We want to use microfiber dusters, not the feather dusters. We don't want to store them on the floor. Keep them upright. I think that speaks for itself. Next slide. Storage is very important. We need to have sinks that we can wash our hands in or prepare medications in. One of the rules, guidelines say that patient care or personal items should not be placed on counters next to sinks. Sinks should not be located adjacent to medication prep areas unless there is a barrier in place. And by what they mean by a barrier is a 3-foot plexiglass or a plexiglass that can be right by your sink. So if you're limited on your storage and your counter space, just put this plastic plexiglass up right by your sink, and then you can have your other stuff there. But you got to have that 3-foot space. And I do believe surveyors are going to start looking at that. And it is to prevent splash from going onto anything that you might take to a resident or patient. You can see that first picture. There's a lot happening there. We've got cleaning supplies, we've got a urine hat, we've got COVID testing supplies, all, within a relatively 2-foot space. So next slide. Don't forget about your kitchen. This was a drain again that wasn't being used, just kind of got neglected. And then that second picture is a dehumidifier that was in the kitchen, blowing cool air right on the food that was going out. So let's be mindful and pay attention to things like that and get that cleaned up. Next slide. Testing location, we always want to be mindful of where we're doing our tests when we're doing things like that. So we're doing a COVID test, but we're laying the swab right on the counter by where they're about to serve their lunch. And you can see that identified by the ketchup behind there. Testing should be done in a private location, not for everyone to see. And we definitely don't want to store our sample kits, our testing kits on the counter. Next slide. PPE still important. Where are we using it? How are we using it? Where are we storing? We don't want to put this jacket on top of our supplies that we're going to use for on a patient's door. We don't want to hang our mask on doorknobs and counters, and we certainly don't want to wear it around our waist on our belt. So make sure your staff know that. Next slide. And I'm just going to close with hand hygiene. Make sure we know our hands are the worst culprit of carrying germs and bacteria. Make sure your soap dispensers work. Make sure your hand sanitizer dispensers work. These are all ones that we found. They're not a place to store our stethoscopes and our keys and every other thing that we have. They're made for one thing, and that's hand hygiene. So next slide. Every action, every day, every time, hand hygiene, infection control. So we're happy to come to your facility if you're interested in that. Like I said, we do nursing homes, hospitals, dialysis, assisted living centers, while there is funding available. These are free opportunities for you to really look at your infection control programs with new eyes, and yeah, we're happy to help you. Some of the things we look at that we didn't mention today, we look at antibiotic stewardship, we look at wound care, we look at your EVS staff and their cleaning practices. Yeah, just a whole gamut of things that we can look at for you. So that's all I have.
All right. Thank you for joining us today and sharing all of that great information. We appreciate all of you for listening in to our office hours call today. Our contact is available through our website, sdprojectfirstline.org. You also can reach out to us through the email or the QR code that's listed here. If you are looking for infection control education for your staff, a big one right now is environmental services training. Those type of things are available through us at no cost to you. Our next office hours call will be Valentine's Day, February 14th. We hope you can join us. And I believe, if I am correct, it is the topic of wounds. So Sherry will be back to share her expertise in wounds with us.
I love wounds.
All right. Thanks, everybody.
Thank you.